Wuhan. We had cases of COVID-19 in Ontario and all over the world, really. So why did those detailed discussions about learning alternatives not start in January?
Well, our program, actually, the developments and discussions within the ministry happened much before Canada or Ontario.
Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, la Dr. Jennifer Russell, et le Premier ministre, l'Honorable Blaine Higgs. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Good afternoon, everyone. Bon après-midi à vous tous. Et je suis vraiment heureuse aujourd'hui que j'annonce pas un nouveau cas de COVID-19. Alors, c'est des bonnes nouvelles, mais on a encore des gens qui sont hospitalisés et on devrait vraiment penser à eux et leurs familles. Alors, mon allocution aujourd'hui, ça ressemble énormément à celle d'hier, mais je ne m'en excuse pas. Quand j'ai le plaisir d'annoncer des nouvelles encourageantes, je suis toujours heureuse de me répéter. Et quand je dois faire passer un message d'importance cruciale, je n'ai aucun problème à me répéter non plus. Encore une fois aujourd'hui, je suis heureuse d'annoncer qu'il n'y a aucun nouveau cas de COVID-19 au Nouveau-Brunswick et le total de cas demeure à 117 dans la province. Notre taux de rétablissement continue d'être élevé, alors que le nombre de personnes infectées ayant dû être hospitalisées demeure faible, mais encore, il y a des gens qui devront recevoir nos prières et nos pensées aujourd'hui. Nos établissements de soins de santé n'ont pas été submergés. Ça, c'est des bonnes nouvelles aussi. Today's remarks will sound a lot like yesterday's, and I make no apologies for that. When there is encouraging news to deliver, I'm always happy to be repetitive, and when there is a serious message to get across, I have no difficulty repeating myself. So once again, I'm pleased to report today that there are no new cases of COVID-19 in New Brunswick, and our total remains at 117. Our rate of recovery continues to be strong, and our hospitalizations continue to be low, but there are people hospitalized nonetheless, and they really deserve our thoughts and prayers. Our healthcare facilities have not been overwhelmed, and thankfully, we have yet to record any deaths due to this epidemic. We continue to look for new cases, and so yesterday we did a total of 586 more tests, and this is our largest one-day volume since the beginning of this event. We must not give this virus any breaks. Everyone needs to keep doing what they are doing. Our neighbors all around us in other jurisdictions don't have that kind of good news to report, so because we know about these situations elsewhere, we do really still have to be very vigilant. Every New Brunswicker must continue to stay at home as much as you possibly can. When you do go out, you must continue to keep your interactions with others brief. I could just repeat because this is the same thing I said yesterday as well, but I'll keep saying it. So you have to stay 2 meters away from each other when you're outside and out and about between yourself and others whenever possible. And when it's not possible, then I do suggest that you wear a non-medical facial covering that covers your mouth and your nose so that you do not spread COVID-19 inadvertently to someone else. Every New Brunswicker must wash their hands frequently and thoroughly every day. Lorsque vous ne pouvez pas respecter les consignes de distanciation sociale, je vous suggère de porter un masque non médical qui vous couvre le nez et la bouche afin de ne pas transmettre une infection de vous que vous pourriez avoir sans savoir. Tous les citoyens du Nouveau-Brunswick doivent bien se laver les mains fréquemment, tous les jours. And if you have any 2 of the 5 symptoms I have described, high fever, sore throat, persistent cough, runny nose, and a headache, call 811 or call your family doctor or your nurse practitioner and follow the directions that you receive. If you are directed to self-isolate, do not go outside your home. Ask a neighbor or a family member to get your groceries and medications. And until it is certain that you are not infected, please refrain from any activity that might allow the further spread of this virus. And it is through these actions that New Brunswick has thus far been spared the worst effects of COVID-19 thus far in the pandemic. Whether that continues in the weeks and months ahead entirely depend on you, and we all must remain vigilant against this disease. And if we are consistent in our practices to limit its spread, we can continue to have good outcomes. C'est grâce à ces mesures si le Nouveau-Brunswick a pu, jusqu'à présent, être épargné par des pires répercussions de la pandémie de COVID-19. La question de savoir si cette tendance se maintiendra pendant les semaines et les mois à venir dépend entièrement de vous. Si nous continuons tous à faire preuve de vigilance pour nous protéger contre cette maladie et si nous appliquons avec uniformité les mesures visant à limiter sa propagation, nous pourrons continuer à obtenir de bons résultats. Mais ce n'est pas facile, alors c'est pour cette raison-là que je continue à vous encourager de faire ce que vous faites maintenant. Quand même que c'est difficile, je connais que c'est difficile pour tout le monde. If we let our guard down, the virus will take advantage and resume its spread through our communities. We have seen tragic consequences of this in other jurisdictions across the world and indeed in Canada, so we don't want that to happen here in New Brunswick. There is a meme going around social media, you've likely seen it, which says that lifting restrictions when they are starting to work is like taking your parachute off before, taking your parachute off, before you reach the ground. And certainly our descent has been slowed, and we are doing better than many of our neighboring jurisdictions in that regard, with regard to the case numbers, hospitalizations, and deaths. So we can all take great pride in that achievement. Un mème Internet qui fait le tour des médias sociaux que vous avez sûrement vu, fait allusion que fait un lever de restriction au moment où elle commence à fonctionner. C'est comme enlever son parachute avant d'atteindre le sol. Il y avait un de mes collègues qui m'avait demandé une fois, il dit, Jennifer, tu étais dans l'armée avant, je lui ai entendu que tu avais sauté des hélicoptères avec avec une parachute. Puis j'ai dit, non, c'est pas vrai. Oui, j'ai sauté d'un hélicoptère, mais je me suis descendue et relevée par je m'excuse, j'ai oublié le mot, avec une corde. And anyway, c'était pas une parachute, mais je l'ai corrigé, mon collègue. Nous avons certainement ralenti notre descente. Nous nous en tirons mieux que de bon nombre des administrations voisines en ce qui concerne le nombre de cas d'hospitalisation et de décès. Nous pouvons tous être fiers de cette réalisation. But it would be tragic if the gains we have made are lost due to carelessness or rash acts by few. COVID-19 is going to be with us for a very long time until there is a vaccine. So no matter what happens in the future, in the weeks and months ahead, we will always have to take care to follow public health measures to stay safe. It only takes a few cases to start rising exponentially in terms of the numbers, and we don't want that to happen ever. Our effectiveness in limiting the spread of this disease is shown in our test results currently. So far, we have seen a relatively low percentage of positive results among the tests taken to date. So out of 9,900 tests administered, just 1.1% are confirmed cases of COVID-19. So far, that demonstrates that our measures are working, and we are proving their effectiveness every day. But what we have to do is keep proving it and keep improving on all the things that we're doing right now. And what we do collectively matters, but what we do individually really matters. So it is thousands of individual decisions and actions made by New Brunswickers each day that is making it possible for us to slow down the spread of COVID-19. So please keep making good choices for your own health and that of your community. We haven't reached the ground yet, so keep your parachute on. Thank you. Merci.
Good afternoon. Bonjour. The past few weeks have been extremely difficult, but there have also been a few bright spots. One positive aspect is the incredible level of cooperation we're seeing within government. I'm proud of how well we have been able to work together through the All-Party Cabinet Committee on COVID-19. Nous avons mis nos différences politiques de côté et nous travaillons ensemble pour assurer autant que possible la sécurité des gens de Brunswick pendant la pandémie. Just this morning, the House sat in the Legislative Assembly to make the changes to the Emergency Measures Act that I discussed yesterday. We were also able to pass an amendment that could allow government to quickly and efficiently set up child care centers for essential workers if needed. Amendments were also made to the Employment Standards Act to address issues related to leaves or absences due to a state of emergency. When we have needed to pass legislation during this time, we have kept the number of members in the House limited and have practiced physical distancing. We have all been working together to do what needs to be done while putting the safety of New Brunswickers first. This morning, Environment and Local Government Minister Jeff Carr and I participated in a call that included the municipal associations and all the New Brunswick mayors. 114 participants in total. Municipal governments are facing many challenges right now. I was grateful to have the opportunity to respond to some of the mayor's questions and to address many of their concerns. Je sais que les gens ont plusieurs préoccupations concernant la reprise économique et le rôle que les municipalités vont jouer. Comme je l'ai dit au maire des municipalités ce matin, notre gouvernement travaille déjà activement sur ce dossier et nous examinons un certain nombre de plans et de stratégies possibles. Nous aurons plus d'informations à ce sujet dans les prochaines semaines. One thing I know for certain is that this is a partnership. Just as the provinces must align nationally, municipalities need to align provincially. Together, the leaders of the four provincial parties represented in the legislature and our municipal leaders need to forge a direction for this province. This will be a very important step for us in moving forward. No matter which party comes into power in the future, there must be a roadmap for recovery, independent of partisan politics and agreed upon by all. I commend Dr. Russell for her work in continuing to increase our testing program. It's encouraging to see more tests and fewer new cases. In fact, several days this week, we've had no cases of COVID-19 in New Brunswick at all. That's great news. Mais nous ne pouvons pas faire l'erreur de retourner à nos vies normales trop tôt. Si nous le faisons, nous pourrions assister à un résurgence de cas. Tout le monde doit plutôt continuer à faire ce pas d'effort. Even once the current restrictions are reduced, I must caution all New Brunswickers, as I said during this morning's meeting with the mayors, we are not going back to business as usual anytime soon. We are all going to need to adjust to a new normal. We will still need to take extra safety precautions as we go about our days, such as practicing physical distancing. New Brunswick borders may need to remain closed for some time, and travel restrictions could stay in place. Festivals and celebrations that we all look forward to attending in the summer months are likely to be canceled or postponed this year. We won't be able to get back to our regular routines right away. This new normal is going to apply to New Brunswick business owners as well. I've been very encouraged by how quickly businesses have adapted to the situation and have stepped up to help out wherever possible. Nous avons vu des exemples d'entreprises qui ont fait des dons importants à des banques alimentaires et à des organismes de bienfaisance. Nous avons aussi vu des entreprises qui ont complètement modifié leurs activités normales pour commencer à produire des articles comme de l'équipement de protection éventuelle, des désinfectants pour les mains et d'autres de tests de dispatchage. I'm inspired by the creativity and cooperation of our business community. As we begin to look ahead to eventually reopening some businesses in the weeks to come, I know this community will continue to be innovative and collaborative. Right now, I want to encourage the business owners that have had to close their doors to start thinking about the future. I want to ask them to start considering how they can reopen once it's safe to do so, while taking new measures to protect the health of their patrons. Again, we are not going to be able to go back to business as usual, but we will move back in that direction. Business will have to think about how they can incorporate protocols like physical distancing. They may need to consider providing equipment like masks or gloves to their staff and perhaps their customers, depending on the nature of their business. We still aren't at the point where non-essential business can reopen, but it's important that they take these factors into account as they plan for the future. I've always said that New Brunswickers are resilient, and we've certainly proved that to be the case during this pandemic. The vast majority of us have been patiently following the direction of public health. Nous restons à la maison. Nous maintenons une distance physique sécuritaire en nous et les autres personnes. Nous lavons nos mains régulièrement et adéquatement. We've been doing our part to flatten the curve. This is no time to get lax. This is a time to ensure that we can continue on the very positive record that has been established. This is a time to have us prepare for a startup in our community, a prepare that won't be as normal, but to prepare for the inevitable for at least the foreseeable future, but until a vaccine is found. I have to ask that we continue to be patient. If we all continue to follow the advice of public health, I am confident we will see fewer restrictions in the weeks ahead. Like all of you, that's something I'm very much looking forward to. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Merci, Monsieur le Premier ministre et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My first question is for the Premier. Premier Higgs, Saskatchewan, British Columbia, Ontario, Quebec, and Manitoba have all deemed funeral service providers as essential workers to ensure they have access to things like PPEs to minimize risk and delays as they do their jobs. Will New Brunswick be doing the same?
Well, I think that in New Brunswick case, our restrictions were a little different in the sense that we focused on what were public-facing businesses. So particularly where we saw a lot of movement with the public every day and routinely. So the fact that nursing or certainly funeral homes are still operating would be a case of following the protocol, following the distancing, following the masks if needed for employees. And I know at this point many funerals certainly have been canceled in an open funeral arrangement like we would have seen in the past. So I actually think these services are continuing to be provided, but in a safe way, practicing all methods of public health.
Thank you. Vicki, do you have a follow-up question today?
I do. Thank you, Bruce. It's for Dr. Russell, and thank you, Premier. Dr. Russell, I was speaking with nursing home workers yesterday who think that regularly testing staff in long-term seniors care facilities, regardless of whether they have symptoms, could be a preventive surveillance measure that could potentially save lives, and it would also make them feel safer. Do you think that testing strategy could be effective as a preemptive measure, especially now that we've opened up testing even more?
So definitely, we've been having conversations with the pandemic task force around testing of asymptomatic healthcare workers. We haven't arrived at a decision in terms of moving forward, but it's definitely on the radar right now for discussing. There are pros and cons to that. You don't want people to have a false sense of security because obviously you'd have to test people on a daily basis really because you can be negative one day and positive the next day, and that's not really feasible. And then if you did test people, then you wouldn't really want them to have a false sense of security that they were negative when perhaps they were about to be developing symptoms. So there are pros and cons that have to be weighed from a public health perspective, and those are the conversations that we're having right now.
Thank you, Doctor.
Thank you, Doctor. Thank you, Vicki. Brianna James, Northern Light.
Thank you, Bruce. Yes, this is for Dr. Russell. The Bathurst Health Zone appears to have done more testing recently, but the number of confirmed cases remains at 1. Wouldn't we expect to see more cases in Bathurst compared to other regions, given the amount of testing in Zone 5 for Campbellton, which has a smaller population and less testing, has 12 cases?
Well, again, I can only say that whatever testing is being done in terms of the capacity, we definitely are able to meet the demand at this time for people requiring testing. With respect to the results of all of that testing, again, I usually the hospitalization rates and the ICU admission rates are reflective of as a proportion of the total number of cases, and we're not seeing that number go up. So I think we are at a good place right now, but I certainly am very, very happy that we have expanded our testing criteria. I'm very happy that our numbers are going up. I think yesterday was our all-time high for a number of tests in a single day. So I think that if we're vigilant and we keep looking, then we hopefully will find cases. But if we don't, and we continue testing at that level, then again, I can only say that it would be reassuring in terms of the data that we're being provided with that. And it does inform all of the decisions that the government will make from a public health perspective and input around what types of measures will eventually be able to relax in what manner and what time frame.
Thank you. Do you have a follow-up, Brianna?
No, I'm good. Thank you, Bruce.
Thank you. Elizabeth Fraser, CBC.
Hello, my question is for the Premier. New Brunswick is an oasis of calm in the middle of COVID turmoil in Quebec, Maine, and Nova Scotia. Who will make the decision on reopening borders into New Brunswick, and what will be evaluated in reaching that decision?
Well, certainly we will, as a government, working with the Cabinet COVID Committee, with Public Health and Dr. Russell, other experts in the field, we will look at that. But at this point in time, we're very focused on maintaining the integrity of our borders. We are a bit of an oasis here right now, and we're blessed by that. And we do not want to lose traction in that regard. So the last thing we'd want to do is take a risk, unnecessary risk, through laxing in any way our border crossing and people coming and going from outside into New Brunswick. This is an opportunity for us to continue our diligence, and it's an opportunity for us to be able to open sooner some of the aspects of our daily lives, and ask, different municipalities, sports organizations, whatever, to look at innovative ways to do the things they want to do, but do it in a new way, respecting the public health requirements. So we can return to normal, or the new normal, quicker. We have that potential, as long as we don't take it for granted, as long as we don't think we're out of the woods here, because we could jump right back into the woods in a real hurry, and it would just take one event, like the case of the funeral home in Newfoundland, where one person infects 17 and 17 go on to infect 150. It just takes one situation, and all could be moved right back into a serious situation.
Thank you, Premier. Elizabeth, do you have a follow-up today?
Yes, I have another question for the Premier. Why is government allowing recreational ATV activities to resume while other outdoor activities like traveling to cottages and fishing are still off limits?
It's a good question. I too was disappointed to read that. I think it's premature. I mean, am I naive to think that someone doesn't go out and take a ride in the woods on their ATV, or take a walk in the woods? No, I'm not. But if through this recent announcement that I saw from the group, if we're indicating that business as usual, we're back open, certainly that is not the direction, that is not the situation. And the concern about that is it simply that people say, okay, we're okay, now let's all get together with our buddies and go on a trip of 10 or 15 and away we go. And that is the issue, is that, we get together in groups, we think, well, we're way out in the woods, what could be the harm? But if you have 10 or 15, or if you have one or two, or I say two or more, I should say, then it becomes a risk, an unnecessary risk. But I know the pressures, and I know what they're facing, certainly the club presidents. I know that the ATV riders themselves, I know they want to get back to normal. And I'm just saying, let's not lose what we have, because the whole province could be affected by it. So the regulations, I would have preferred, obviously, that it didn't proceed, and it certainly wasn't something that we sanctioned from our offices.
And I'm hearing of a lot of people talking about wanting to go to their cottages this weekend and planning to go to their cottages. What would you say to them?
At this point, we are encouraging for, only activity like within your community or staying local and not moving across the province. But I am sympathetic to that situation. I mean, I recognize that in New Brunswick, we have different areas that we like to go, and I feel the same way personally. And I'm hopeful that we'll work through a program here with public health that will allow us to have some freedom within our province and to be able to do that soon. We are focusing on this, as I said earlier, from the long weekend in April for the next 10 or 14 days to get a good indication of where we were. And then how can we allow people to, get out in their cars, not with other people, but with the case of in their own homes, their own family. How do we allow movement throughout our province to, whether it be a farm or a cottage or camp or whatever? Because I know there's a need to do that, and I know we need to find a way to make it happen, because people need to have a hope that we're going to return to a normal way of life as best we can while we still follow the public health rules. We'll find a way, but I'm asking people just to be patient for a little bit longer.
Thank you. Andrew Waugh, Telegraph Journal.
Yeah, thanks, Bruce. My question's from the Premier, Premier Higgs, just going back to the ATV story, there's a memo or a letter that's been issued by the ATV Society that actually quotes your Natural Resources Minister, Mike Holland, as saying everything's fine and they're sure that the ATV community will follow the rules. So what's going on here? You're not a fan of it, but he's given it the green light?
Well, there does appear to be some discrepancy there, Andrew. I appreciate that. Certainly as we look for, and I know that Mr. Holland would be under a lot of pressure from the group in terms of, how do we get back to normal? So I will just ask now for, clarity amongst the group and the clarity amongst the president of the ATV club or the association is to recognize that we cannot have large groups. We cannot have 5 and 10 people, or 2 or more people that are traveling and congregating no matter where they do it in the woods, because that could bring the virus back to their respective homes. And that is the concern. So, I think the messaging got a little offside here. And I mean, those things happen. And so I just don't want anyone to read anything more into that than a bit of different communication and a bit of, we expect people to follow the rules, but we cannot relax our situation at this point in time and allow exposure to friends and neighbors, because that's where it all kind of can fall apart.
Thank you. Andrew, do you have a follow-up today?
Yeah, I do. Thanks, Bruce. Once again, it's to the Premier. Premier, you made a reference in your opening remarks about how some summer festivals and concerts might be canceled. We're hearing that that's already kind of happened. The 506 concert in St. John, for example. Can you tell us, has the province already told these concert and festival organizers that there won't be any concerts this summer?
Well, I don't think there's been an official decree as such, but I think everyone is reading the writing on the wall, and certainly the discussion that I had this morning with the municipalities and the mayors and councillors. It was such that there's no likelihood really at this point in time that we could be in a position to have mass gatherings like a concert or like a big festival. That really is not going to be in the cards this summer. And that likely is something that cannot change until we get a vaccine, or we have a very different protocol for how we manage a concert. Because at the end of the day, if we don't respect the requirements, we could lose this, as I've said earlier. So in my discussion, I was certainly very clear that I couldn't see any way that would happen. Could there be events, sports events, and what I'm talking about, we talked about baseball. Could you play baseball and have all the protections and safeguards? I don't know if it's possible. I don't know what activities might be possible, but it will be very clear that the public health requirements for safe practices must remain, and they must remain for the foreseeable future.
Thank you, Premier. Silas Brown, Global TV.
Hi, Premier. I wanted to ask you some stuff about the legislation that was passed today, particularly looking at the emergency daycare centers. I'm curious if you can walk us through some broad strokes of how that's going to roll out. The act itself, the amendment, is it really just says that it gives the minister, the government, basically the power to do this. But I'm curious how this is going to work, or if you can give us something at least broadly about how it will work.
Well, at this point, it isn't any more than having the authority, should we need it, to back up the essential services daycare requirements. So that is all. In some areas, it was more difficult to find daycare for essential services workers, and that was the reason that, okay, if I have that in place, then that would mean we could use school facilities. The minister could make moves forward in order to provide a facility if needed. So I think the big part of this is the if needed, because we're not looking to go out and start a daycare in the school facilities at the expense of the current ones that are in operation. We want those to continue, and we're hopeful they will continue. It was just to provide the backup if and when needed.
Thank you. Silas, do you have a follow-up today?
Yeah. When I asked you about this a couple of days ago, you said that this was intended to plug some gaps in the systems where there were people who were unable to find daycare, anywhere close to where they live or work. So, is this needed right now? Will there be some provincially run emergency daycare centers opening up, or is this still a just in case?
So right now, there are no situations that I'm aware of that are immediate. I think there's some cases, maybe the longer this goes on, there may be some challenges, but I'm not aware of any situation that is required to put this in force at this point in time.
Thank you, Premier. Thank you, Silas. Adam Harris, Telegraph Journal.
Thank you. A question for Premier Higgs. Premier, in your discussions with the premiers last night, did you broach the idea that New Brunswick could be one of the first provinces to begin peeling back the restrictions in place? What was the reaction to that? And is there any call for a national coordination at all?
Yes, Adam. In both cases, there was a discussion with the Prime Minister about, there are different regions of the country that could be in different positions for opening up and kind of in a direction for recovery. And because up to this point, the Prime Minister had been talking about Canada as a whole and, the year and a half or year out. Now, we know that the vaccine is, potentially that long away, so I think that was guiding much of his comments. What we talked about and what we provided was there are very differences across the country, and we referenced three provinces particularly. We were one, Saskatchewan was one, and PEI was another. And it was, we may be in a different position, but again, I caution that that both the direction from public health is favorable to any changes we make, and that we can do it in conjunction as we move forward in the right direction. But we were asking, and I guess making it very aware, as Premier Moe was as well, and as Premier King was, that there may be some areas that we felt we could move forward, while at the same time protecting our border strengths. Because I don't see anything immediately changing in our certainly the control around our borders. And if PEI and New Brunswick were in a little different situation, you may think about that. But right now, we're pretty focused on protecting our border.
Thank you. Do you have a follow-up, Adam?
Yes, please. This one's for Dr. Russell. Dr. Russell, New Brunswick's caseload continues to be remarkably low, but is there a level of testing, we're at about 1.3% of the population right now, that you'd like to reach before entertaining lowering restrictions?
Well, it's definitely something to take into account as we move forward, because one of the things that is sort of recommended by public health in our conversations is around, as you relax measures, what are the public health things that you have to have in place? You definitely have to have capacity for testing, you have to have capacity for contact tracing, and so all those plans have to be in place before measures would be relaxed and concurrently. And so those things are definitely there. I don't think we'd have an actual target at this point. And the different, again, indicators that can be used can include things like hospital capacity, hospitalizations, ICU admissions, et cetera. So there are different indicators out there, and definitely the testing and contact tracing has to be part and parcel of that.
Thank you. Laura Brown, CTV.
Hi there, Premier. I'm wondering, can you update us? I know that you kind of mentioned it yesterday with the fiscal situation, but this year you were projecting a $92.4 million surplus. Can you at least tell us that, is that gone at this point? Are you looking at more of a deficit than that surplus?
Oh, absolutely, it's gone. I made the comment that, we as a team, and I say a team, a nonpartisan team in many ways, passed a budget in record time, and I think it was about 17 minutes. And in less than 3 weeks, it wasn't kind of worth much at all in terms of what it was projecting. Things changed so rapidly, and we saw such a different outlook. So yes, the surplus is gone. The ability for us to pay down the debt is certainly, I would say, not probable at this time at all. We would be in deficit territory, but we're now trying to put all of the facts together, see what impacts that it has across the network. But our top priority will remain protecting the citizens of this province, and we'll go from there.
Thank you, Premier. Laura, do you have a follow-up today?
Just a quick one, somebody else's question. Just a clarification on mass gatherings. So you're saying that likely this summer people shouldn't expect to gather in large groups like a wedding, or concert is one thing, but people who are trying to prepare potentially weddings in the summer, this is good information for them.
I guess it's a good time to save on weddings by reducing the number of people you invite. Is there a way to move this? I know there's some facilities that are extremely large. At some point, I realized the bride and groom need to get together. But the idea of us looking at weddings and looking at can they open, I would say that as with any business, as with any operation we're considering, it's can they provide us, and I say us because it's public health and ourselves and all of the group that's working around to ensure compliance, can they provide us with a method of operation that would allow the physical distancing, would allow the proceedings to take place, and then can we work through that? Because when I talk about a new normal, it's not like we just cancel everything. It's about finding a way to actually do what we want to do and do what we would like to do, but do it in a safe manner and that can adhere to the guidelines.
Thank you. Monsieur Rachnog, Lac des Nouvelles.
Oui, bonjour. Ma question est pour le Premier ministre. Hier, vous avez annoncé que les centres de jardinage pourront ouvrir leurs portes au Nouveau-Brunswick. J'aimerais savoir, avez-vous l'intention de permettre progressivement à d'autres secteurs très ciblés de rouvrir leurs portes? Et si oui, quel type d'entreprise pourrait rouvrir leurs portes en premier?
I think that, in this process, it's about can they operate safely? So when you think of a gardening center, and I think about the Saturday mornings and the yards full, well, we can't have that. We can't have a situation where crowds of people move into a garden center and they can't follow the program. So a garden center will have to validate that they can indeed follow the rules and allow patrons to come and go and maintain our physical distancing and the self-habits, maybe certainly wearing masks. The idea of the gardening centers was simply that many people like to work around their homes in the spring. Many people want to get out and work in their garden. And we have to provide some opportunity for people to do that. And so it must be practiced safely, and it must meet those standards. But we will work with the particular companies and make sure they follow the rules, and we'll be watching closely, because we can't let something like that again spark a rise in the virus spread. In the case of other programs or other businesses, over the coming our goal is to present this to our cabinet COVID committee and then to the cabinet next week. So we'll start next Wednesday night. We're going to present an economic recovery plan that kind of will identify, different businesses that could open, different facilities within municipalities. That's why I had that meeting this morning because I want the municipalities to be part of this, because we're coming up together. In our province, we're coming up together, and we want the municipalities to set priorities, and we work with them, so we're doing it harmoniously but safely. So we'll be rolling that out, but I want to first meet with my colleagues and the Cabinet Committee and basically say, okay, does this make sense? Does this work? Have you got some thoughts? We're hoping that MLAs from all over the province and will be feeding into their respective leaders so that we really have a Made in New Brunswick recovery plan that people feel good about, they feel part of, they take ownership for it, and it gets the results we need.
Thank you. As-tu un suivi, M. Rachnog?
Oui, toujours pour le premier ministre, puis c'est sur le même sujet. Est-ce que vous pouvez nous donner une idée des secteurs ou du type d'entreprise qui pourraient peut-être reprendre leurs activités en premier?
I think you could see, retail shops that, can control the aspect of people coming and going. So you could see more activity around retail. You could see more activity around maybe different shops, whether it be, hairdressers or whether it be, but they wear the protective equipment. We have real good protocol. It can vary because we're looking at trying to open up society again, get people back to work, but in all cases, having a very strict protocol of what's required to meet the standards. And I think, given what we've seen to date in the large compliance rate, I think people are ready to get back to work, but they're ready to do it properly.
Thank you. Merci, M. Rachnog. Daniel McCready, CBC.
Hello there. My question is for the Premier. The Cities Association is calling for provincial and federal support to help keep transit systems operating during the pandemic as they face reduced fares, lower ridership. Is that something that the province is considering, supporting, transit systems?
So we are in discussions about that. Of course, we have to look at the ridership and make sure that it is reflective. The routes are reflective of what's actually the demand is, and so it's reasonable in that sense. But we're looking and working with municipalities in all aspects to determine what are their priorities and what is the area that they need to focus on the most to start up and to have continue. So yes, I have said to them that it isn't a blanket approach. It isn't one, because there are federal programs that we look at that will be part of this. And anywhere from what we've heard in terms of the financing, and I know according to the Municipal Financing Act that they're not allowed to run a deficit. Well, in this situation, that likely will change, and we've seen other provinces do that, and we discussed that a bit this morning. So I want to work with them. So it's not a cookie-cutter approach, but it is an approach that brings the best value to the particular municipality.
Do you have a follow-up?
Yes, also for the Premier, healthcare professionals have been coming out of retirement to help during the pandemic. Is there still a need for them? And, do we have enough staff across the province, especially in nursing homes?
It's my understanding, and I'll certainly let Dr. Russell if she has anything to add to this, but it's my understanding that our current staffing levels are good. I know that there's discussions, and I'm very pleased to say that working with the unions and prior to this with their agreements that, we could have look at movements as needed. We're certainly monitoring very closely to ensure people's work schedule is appropriate, that we're not seeing, situations that people are working excessive hours and getting tired and unnecessarily, because we don't want to allow that to happen. There's been some discussion about I think in terms of temporary casual workers and movements, so that's being looked at so we can ensure that workers can work in one facility. So we're looking at all these mitigating factors, and I know it's being worked at in health and in social development, because we want to be sure and we want to hear about it. So certainly if there are any issues related to the workplace, my office is open, but I know there's lots of avenues to have those discussions to make sure they're addressed and addressed quickly.
Thank you, Premier. Matthew Waclomo, l'Acadie Nouvelle.
Bonjour, ma question est pour M. Higgs. Le chef du Parti vert, David Kuhn, demandait tout à l'heure une reprise des travaux à l'Assemblée, une sorte de retour à la normale, tout en suivant les directives de la santé publique. Qu'est-ce que vous pensez de cette idée-là et est-ce que c'est possible à votre avis?
This was a discussion that we had as a group of 4 leaders this past week. And the general consensus at the end of it, we were just putting in place another 2 weeks of the Emergency Measures Act. And we would re-look at this 2 weeks from now and determine whether we are in a better position to bring the legislature back. You know, various discussions around the room were related to, you know, should we be, it is necessary to get democracy back in action. Are we able to move forward in a proper way? I guess, you know, thinking about how we've been working effectively together in how we establish the economic recovery model, I really believe we're kind of onto something here with the nonpartisan approach to building an economy roadmap, an economic recovery roadmap, and something that will stand the test of time, at least till we get up and running. We build long-term targets, we build a plan forward, and we build a process that, as I said in my speech this morning, that becomes something that can stand the test of time, but more importantly, it isn't felt it has to be reinvented through every new government or through every new election. It may have to be revised, updated, changed, refocused, but you're on a path of recovery and a path to a future rebuild and to go well beyond where we were as a province.
Je vois comment as-tu suivi?
Oui, s'il vous plaît, toujours pour M. Higgs. Avez-vous peur que le retour de la période de questions et puis le retour des déclarations des députés pourrait peut-être nuire à cet effort non partisan de relance et de gestion de la pandémie? Est-ce que c'est pour ça qu'on n'a pas encore vu une période de questions, par exemple, à l'Assemblée?
Well, the reason we haven't had a question period is because when we're asking others not to have gatherings in a place, then who are we to be different than that? So we're only following our own rules and the rules of public health in that sense of protocol. So there's the rationale for not having the legislature be as normal. However, if you think about the legislative process, there probably isn't any place that's it's more pronounced to have the partisan politics, you know, be front and center. So, but the reason to return will be based on our public health condition and the ability to return because of that.
Merci. Michel Corriveau, Radio-Canada.
Oui, bonjour. C'est une question pour Dr. Russell. J'aimerais savoir, Dr. Russell, quelles mesures ont été prises au Nouveau-Brunswick pour éviter de se retrouver dans une situation avec les foyers de soins comme vit le Québec en ce moment?
Alors, il y a beaucoup de leçons qu'on peut apprendre de nos voisins dans d'autres provinces. Alors, on a des directives du Santé publique du Canada, l'Agence de santé publique du Canada. On a des directives ici, pas de visiteurs en dehors. Il y a des questions que tous les staffs ont besoin de répondre avant rentrer. Il faut prendre la température. On travaille beaucoup avec un groupe de travail, avec les mesures je m'excuse. Dans le département de santé, on a un groupe de travail pour les foyers de soins avec le développement social aussi. Alors, tous les partenaires, on discute c'est quoi les choses qu'on devrait faire pour que les foyers de soins sont les plus sécuritaires pour les patients et pour les travailleurs, même garder si les travailleurs devraient seulement travailler dans un endroit. Alors, ça, c'est quelque chose qu'on veut discuter aussi. Et alors, toutes les choses qu'on sait que devraient être en place pour que les endroits soient aussi tant sécuritaires qu'ils peuvent être, c'est les choses qu'on essaie de faire maintenant.
Merci, M. Corriveau. As-tu un suivi?
Oui, Bruce, merci. C'est toujours pour Dr. Russell sur le même sujet. J'aimerais savoir, est-ce qu'il y a des besoins particuliers? Là, vous avez évoqué de l'importance ou de la possibilité des travailleurs de travailler toujours au même endroit. Mais est-ce qu'il y a des besoins particuliers de personnel ou de ressources dans les foyers de soins?
Je crois que originalement, quand on avait des discussions sur ce sujet, on savait qu'il y avait des gens qui travaillaient dans plusieurs endroits. Et s'il fallait choisir un endroit, parce que ça se peut qu'ils travaillaient dans les réseaux, dans les hôpitaux, etc., alors il fallait garder la situation de chaque employé pour voir, OK, ben s'il devrait travailler à une place, il faut que ça soit le foyer de soins pour protéger le nombre de gens qu'on a besoin pour travailler là.
Au niveau des ressources, il y en a assez?
À ce moment-ci, je dis oui.
Merci, Michel.
Merci.
Michael McDonald, Canadian Press. Michael? Michael McDonald.
That concludes today's update. Thank you very much. Voilà la fin de notre mise à jour. Merci beaucoup.